Welcome, everyone. We're very pleased that you're here today to join us for the Diabetes Fireside Chat with the Access to Medicine Foundation. This is the second Fireside Chat, and it's part of our Voices of Our Community campaign. And this project belongs to the impact stream of the Access to Medicine Foundation and the Diabetes Care Program. Today, we're here to talk about scaling up access to glucose self-monitoring devices along the diabetes continuum of care. And it's my great pleasure to be joined by four esteemed panelists who I'll introduce in alphabetical order. Joining us from Roche Diabetes Care, we have Andreas Altemark, who is the head of Global Market Access. Adrian Gut, who is the Senior Director of International Access and Government Affairs from Dexcom, is also joining us. Dr. Seynabou Mbow is the head of Cardiovascular and Metabolic Disease Control, the NCD division at the Ministry of Health in Senegal. And Dr. Beatrice is joining us from FIND, where she's the Director of Non-Communicable Diseases in the NCD program. My name is Karen Eryou, and I'm the Head of Industry Engagement at the Access to Medicine Foundation. We're going to start off our panel by hearing from each panelist on a particular question around partnerships. And so I'd like to ask each panelist, and we'll start with Andreas, to please tell us about the role of partnerships and how do partnerships facilitate access to glucose monitoring devices and associated commodities and LMICs. Andreas, the floor is yours.
Many thanks, Karen. And let me start with saying that it's a great pleasure to be here with you, with the other panelists. And we are really happy to have received the invitation from the ATMF. So many thanks for having us. So that is really a pleasure. Let me start off by saying that we in Roche, and I think I can speak for Roche Diabetes Care, but also for the Roche Group, that we are committed to improving access to our innovative health solutions in the entirety of the portfolio. So that ranges from pharmaceuticals, as everybody probably knows, also to the medical device portfolio. And specifically for Roche Diabetes Care, it's true that we believe we should make our solutions available to all patients, irrespective of where they live. So that includes any market, any country in the world. And in doing that and doing that successfully, we believe that partnerships play a crucial role. We can offer our solutions, and we are ready to provide our contributions. But also at the end of the day, what we really want to achieve is a comprehensive holistic care for people living with diabetes. And so, yes, we will provide our contributions, and then we believe we can only provide the holistic care by being joined by other partners. So to provide in the end a treatment, the monitoring, the administration, and then also other elements such as education. And at the end of the day, this then is to be serving a vision that can be summarized as together stronger. And that is something that we stand behind and that we believe in. And to provide you with an example, we have been in a public-private partnership with Novo Nordisk in a program that is called Changing Diabetes in Children. And we've been inaugurating that program in the year 2009. And up to this point, we've been able to supply 48,000 children and adolescents living with diabetes with supplies that are really needed and life-saving for these children and adolescents. So that includes obviously blood glucose monitoring, that is something that we can provide, but it does also include the treatment by Novo Nordisk and other elements that really provide a good solution for these affected children and adolescents. And to summarize, by the year 2030, so that is not so far away, as we sometimes may think, but 2030 is close, and we want to reach by that time 100,000 children worldwide with this program. And this is just one thing in a mix of many, because also we have been embarking on other projects and other partnerships, for example, with the NCD Alliance in Kenya, where we're reaching around 300,000 people that may be exposed to health risk, including diabetes. And so here we have been embarking on a screening program. And also in another country, such as Pakistan, we're collaborating with the NGO Green Star to move the needle for women with gestational diabetes. And so that is just a couple of examples that underline the importance of partnerships to us. And then I probably should hand it over to the other panelists as well to give them their time to share their thoughts as well.
Thank you, Andreas, for your remarks. Now I'd like to turn over to Adrian to hear a bit about your perspective on the role of partnerships.
Also from my side, a big thank you for the foundation, first of all, to organize the discussion on this important topic and to have me as part of the panel. And what an excellent question to start with, because partnerships really play a key role for us when we think of access. And this is true whether it is in country with highly developed healthcare systems or in low and middle income countries. The role and the purpose of partnerships are very different, of different nature, as the barriers to access can be very different from country to country. So, for example, in some European countries, we partner with patient associations, clinicians, or clinician groups to influence towards positive policy change to improve access to, in our case, the CGM category. On the other hand, in low and middle income countries, access barriers include things like lack of healthcare infrastructure, lack of awareness, training, education, etc. So for us, meaningful partnerships are outside of just commercial partnerships, of course. Meaningful partnerships are more with groups that have common interest and experience in these areas. So long story short, partnerships are absolutely a key element for us at Dexcom to improve access across the world.
Thank you, Adrian. I'd now like to turn the floor over to Dr. Mbow to tell us a little bit about partnerships from her perspective.
So thank you, Karen. Thank you to all the panelists for giving me the opportunity to participate at this Fireside. Modifications, partnerships play an important role in facilitating the access to essential technologies for diabetes management. In Senegal, the drug supply policy is managed by the National Supply Pharmacy, which, thanks to partnership with the pharmaceutical companies, have been able to make available a wide range of glucose monitoring devices. As a result of the Ministry of Health monitoring activities in health structures, blood glucose measures are almost always available. This is the result of good collaborations between the government and its partners, which have led to the implementation of initiatives in order to improve the quality of care for diabetic patients, with the example of CDIC, Changing Diabetes in Children, and BOP, Base of Pyramid project with Novo Nordisk, and above all, the availability and accessibility glucose monitoring devices, which the final objective is to reduce the morbidity and mortality. Thank you.
Thank you, Dr. Mbow. Beatrice, could we hear from you now, but on your perspective from FIND and partnerships?
Sure, thank you, Karen, and thank you to the Access to Medicine Foundation for inviting FIND to this Fireside chat. So partnerships are really at the core of FIND's operating model, right, where we work with healthcare providers, people living with diabetes, country decision makers, and manufacturers to overcome access barriers to glucose monitoring devices and to make testing really an integral part of diabetes management. Through these partnerships, we aspire to address the whole value chain required to enable equitable access to glucose monitoring in low and middle income countries. And this starts with identifying suitable fit-for-purpose technologies and partnering with their manufacturers to develop access strategies around technical, pricing, and supply aspects. At the same time, we partner with in-country healthcare providers and people living with diabetes to generate local performance and usability data to address any barriers a technology may pose and thus facilitate uptake. Further, we build capacity in the health system through partnerships with training experts so that the healthcare providers can integrate testing into patient management in an evidence-based manner and through that additional capacity. And really, last but not least, we work with country governments and policymakers to address gaps in evidence and structural requirements which may pose a barrier to successful implementation and uptake of glucose monitoring. At the global level, of course, we partner with organizations who complement our work through initiatives for better access to insulin. And that is really to recognize that access to medication and glucose monitoring tools go hand in hand.
A segment of the panel where we're going to spend time deep diving into each one of these organizations and work that they do. I'd like to start off with Andreas for Roche Diagnostics. Andreas, your organization has been on quite a journey over the past 2 years. And we understand that you look at least 3 different levers for your partnerships. You look at improving screening, you look at affordability, working in collaboration to bring the change and provide solutions at affordable price points. And then there's the question, of course, around enabling reimbursement. As you've been on this journey, can you tell us a little bit more about the work that you've done?
Sure, it's a pleasure. Thank you very much, Karen, for the question. I've started with saying that we put patients at the center of what we do. And so since the 2 years that we have been strengthening our efforts in improving access to our solutions, especially also in LMICs, so low and middle income countries, we've started with a structured and orchestrated effort in the end, with the end in mind that we want to be real and tangible on the ground. So we have screened a number of countries, like specifically 85 countries that represent 50% of the world's population, and we have prioritized them with a primary question: are we capable of bringing change? And so in that we have prioritized 13 countries. And in these 13 countries, there live quite a substantial number of the 430 million people with diabetes that are in the end living in LMICs, and they have the unmet need that we do see in these countries is huge, because only 50% of those are diagnosed, and then out of those, only 26% have access to blood glucose monitors specifically. So you can estimate how big the unmet need is, and also the level of change that we can bring and that we intend to bring to these patients. So you've spoken already about the 3 levers that we have primarily identified. So this is the screening, so identifying and finding these patients, so that in the end they can be helped and we can provide a solution for them. But then also the affordability lever, and then finally the reimbursement. So affordability in the end can be described as our contribution to the mix. It is the understanding that we need to take into account the affordability question. So what is the level of affordable sources, funds that the patient has, if that is supposed to be paid out of pocket or the copay. And essentially, when we screen these markets, it's obvious that that is the prevalent situation for most of them. So that is the second lever, and then the third is the reimbursement, and that goes hand in hand also with the understanding that we seek to establish self-sustainable solutions. So in the end, donation is great, and donation often has a very specific focus in time, and also often a geographic focus. And so in order to provide a mid and long-term solution, we need to translate these efforts into a self-sustainable solution, and that then goes hand in hand with the reimbursement. Now, in the 13 countries that we have prioritized, we've brought forward over the past 2 years, we've initiated 21 access initiatives, and now they start delivering, and they start creating impact on the ground. And so this is, I think, then also where these things start. That is to say, it's important to have an ambition. It's important to be clear on what we want to achieve. But then it's even more important to get started locally on the ground, to help, to be of help, to be relevant, and to advance access to care in these geographies.
Andreas, I'm going to ask you one more question, okay? So as you've described these incredibly important initiatives and your work as a manufacturer of blood glucose monitors, can you tell us a bit about how this impacts those living with diabetes?
Yes. So the impact, when you look at the 3 levers, then also the impact is coming through them, in the sense that if we embark with partners, specifically NGOs, on screening programs, then obviously we identify people that are at risk, and in that we open a door then also to the further care. So this is how the effect materializes in the screening, when we think about the lever of screening. And then when we think about affordability, is essentially addressing the funding for people that need to pay out of pocket. And when then these funds are not sufficiently available, that we think about ways of addressing that unmet need. And an example that is relevant in that context is microfinancing, where we are currently in discussions in Nigeria and also Pakistan with institutes and other partners to the theme of this fireside chat to really offer help and support to patients that otherwise cannot secure the funding. And then the third lever is the reimbursement. And the reimbursement is very important to advance the discussion, but also do not advance the discussion out of the blue, but really be real and able to also substantiate what's in for a government, what's in for a country, what's in for patients. So really have alongside in these discussions the evidence that actually in improving access to the treatment, but then also specifically here the blood glucose monitors, that we can actually bring change in the way that we provide care, and that these people with diabetes are able to access care.
As Dexcom is ramping up its activities in LMICs, could you tell us about the Dexcom One model that exists in Europe? What are the challenges that you've faced, and how have you worked through these challenges? Subsequently, then you could tell us a bit about how you're thinking about translating this program into an LMIC or LMICs. Thank you. The floor is yours.
Thanks a lot, Karen. Happy to talk about that. So since diabetes is a complex disease, and as we know, and it affects people in very many different ways. So a few years ago, the Dexcom leadership actually decided to address this with the portfolio approach. So similar in the cardiac field, you have different defibrillators, pacemakers, etc., depending on what the need is of the different patients. And in that spirit, really, we launched a new product, as you said, called Dexcom One. In addition to the G6 and the G7 products. Dexcom One is a bit simpler product, but it's based on the exact same technology, has a bit more basic features. So this really allowed us to offer it to different patient groups and also at different prices. This process we started in Europe. So Dexcom One was first launched in Europe, some Eastern European countries most specifically. And of course, we had to learn quite a lot to do things differently. For example, our distribution channel now includes e-commerce options where this may make sense. So we had to up our game a bit and learn a few new tricks. But launching Dexcom One allowed us to introduce this technology in countries and real-time CGM in countries where it previously was not available. And I'm happy to report that we made quite successful and quick progress to get payers to cover the CGM category in many patient groups, and again, most notably in Eastern Europe. So now, what does this mean for our longer term plans and for our consideration to like you say, ramp up into LMICs as well? So we're now in the process of developing plans on how we can apply these lessons learned and further expand the availability. So this could, of course, include further product iterations. It can include new partnerships, since we spoke about partnerships earlier, new distribution models, etc. Thank you.
One last question. Could you tell us a bit about the impact, how did the impact for people living with diabetes, maybe just focusing on the European work that you've done with Dexcom One?
Yeah, so, in today's connected world, of course, people with diabetes, just like any other community, are extremely well informed, and they all know about the newest technologies available. And so, offering a good solution for diabetes management, we have often been asked, why don't you launch in my country? When are you coming to my country? And so when we introduced Dexcom One in Europe, as I said, we could give a positive answer to that request in quite a few countries. Again, for example, the Baltics, which was our initial launch, but then some other Eastern and Southeastern European countries. And obviously, real-time CGM is the standard of care for diabetes management, and the impact on people is basically the same as anywhere in the world. As people are getting access to new technologies, they are getting better care. They're more empowered to take decisions on their diabetes management. Their outcomes improve, their quality of life improves, just like anywhere else in the world.
Thank you very much, Adrian. I'd like to turn now over to Beatrice, and we have a couple of questions that we'd like to ask you. You already in your opening remarks talked about some of the collaboration and the work that FIND does with different organizations. Could you tell us a bit more about the work you do with the manufacturers, governments, and healthcare organizations in order to enhance access to glucose monitoring devices in LMICs? And maybe we could also ask you to touch on some of the future priorities as you work with the manufacturers of devices. I turn the floor over to you. Thank you.
Sure, thanks, Karen. And I think the FIND is in a really unique position as a non-profit NGO. We can often work as facilitator, to bring all these different stakeholders you named together, and also work with them separately, obviously, to bring to the table what they have uniquely to offer to advance the agenda. So when we collaborate with manufacturers in the diabetes space, that happens at the moment through affordable pricing discussions, where we aim to put in place long-term agreements between FIND and the manufacturers, and then these agreements can be accessed by LMIC procurers, so those in low-income countries who buy, that can be governments or private sector pharmacy, healthcare, hospital chains. And the interesting thing about this is that the procurement is volume independent. So even those with smaller purchasing power can achieve more affordable pricing. And we currently have long-term agreements in place for blood glucose monitoring devices, as well as HbA1c point-of-care devices with a range of manufacturers. But then we also collaborate with manufacturers in terms of product evaluation. So where we often, bring together a portfolio of devices or technologies to evaluate them in country, right? And that is, of course, also interesting to the manufacturers because it generates local data and builds trust and enables access to their solution. The collaboration with governments really happens through engagement in policy conversations to understand the data gaps governments may have in order to make informed decisions. I think it was mentioned earlier, obviously, that health economic evidence is always very critical. It's a key conversation around access to better self-monitoring in terms of blood glucose test strips, because many governments only to a limited extent provide these to people living with diabetes. And of course, the same conversations are critical for CGMs, though a little bit more on the nascent stage at that stage. And we're playing quite a role in, engaging governments in, those initial conversations to understand what the pathway could be to provide access to and better access to both of these technologies. Once more, so this is through evidence generation, and then we also join where we can technical working groups at government level to talk about product specifications. And we've worked with a couple of governments in defining, their requirements for procurement, and also the ask that they can make in, for example, a tender, as well as in point-of-care testing solutions. And then collaboration with global and local healthcare organizations, as well as critically people living with diabetes, is key to our work, where we convene workshops to bring everybody together and talk to each other and listen to each other about the barriers and the context-specific co-creation of solutions. Then, people, the healthcare providers and people with diabetes participate in our studies. So we really create some momentum in a specific country, in a specific setting around better access from all aspects, because obviously the barriers in access to glucose monitoring are not just technical and instrument solutions, but also, other aspects in engagement with the community and so forth that can improve the situation. And then you sort of asked me about the future priorities and vision for manufacturers. I think to me, a priority really should be and I think it's sort of happening, to create an access strategy, particularly for LMICs at a global level, and an access strategy that goes obviously beyond the donation programs. And the donation programs are needed and they have their place. But I think global access strategies for manufacturers to their technologies need to meet the needs of both sides, right? The buyer and the manufacturers. And of course, prices play a key role in reaching more people, but also it needs to be happening in a sustainable business model manner. So really, I think I look forward to what's more is coming from manufacturers in terms of creativity in product and pricing strategies for access models. And at the same time, recognizing that the current marketing strategies will never reach all people with diabetes. Right? So I think to me, that should be a key priority. And I want to say, it's been mentioned for the CGMs, it's also a great priority for us to make the product available in more countries, because we hear a great deal of frustration from people in many LMICs that they can only procure CGMs through unofficial channels. So I think that is also definitely a priority that one, would like to manufacturers to look at in a derivative and sustainable manner.
I want to ask you also an impact question, like I have asked to Andreas and Adrian. Our organizations have had chances to work together, as an example also where we can partner and where we can collaborate. Could you just talk a little bit about how our work aligns and we support each other in the space that we're working in?
Yeah, absolutely. Look, so like FIND, the Access to Medicine Foundation works closely with manufacturers, right? And while FIND collaborates in a very direct manner with manufacturers through activities of some of those I've just described, the Access to Medicine Foundation plays a really strong role in putting this value creation into measurable context in terms of impact measure. And I think that's really key, and it becomes increasingly important for all businesses, as we are all aware of the term of impact, and not only measuring commercial return, but also improvement in some of the sustainable development goals. Of course, in our case, that would be health. And I think it's great to see that the general conversation around access to insulin that has been present a little bit longer in this space has now been strongly extended to include access to glucose monitoring tools in the recent years.
Thank you very much, Beatrice. Dr. Mbow, I'd like to turn the floor to you, and we have some questions for you. Could you tell us how the Ministry of Health in Senegal partners to address challenges related to accessibility and availability of glucose monitoring devices to ensure equitable access for individuals with diabetes across the region? Dr. Mbow, the floor is yours.
Thank you, Karen, for these questions. Following the STEPS survey carried out in 2015, which revealed a diabetes prevalence rate of 3.5 from 3.4% and 44% of the population unaware of their diabetes status. Policy to decentralize prevention and care were drawn up by the Ministry of Health and Social Action through the NCD's control divisions. Strategies aligned with the continuum of care to reinforce the prevention, screening, diagnosis, and monitoring of diabetes at community level has been developed. All this is underpinned by the availability and accessibility of essential medicines and technologies such as blood glucose meters. As part of the implementation of policies to fight diabetes, standards and protocols have been disseminated to healthcare providers, and communication activities have been carried out to raise public awareness about the importance of early detection. Indeed, the outside blood glucose meters were too expensive, but as manufacturers diversified, the cost came down, and monitoring meters are now more or less within the reach of the general public. Thanks, Karen.
Dr. Mbow, I have one additional question. You have many companies and organizations that approach you to partner on initiatives, and this can sometimes be an additional burden of work. Would coordination by companies in partnerships help to alleviate some of this work?
Okay, companies and NGOs involved in the fight against diabetes are approaching us to implement projects to strengthen the health system. In order to be fully in line with the country's need, we share with them the policies to fight against NCDs, and more specifically, diabetes. Thus facilitate the job, since the basic documentation already exists, and it will just be a matter of adapting it to the context in order to implement the initiatives. Thank you.
Thank you, Dr. Mbow. This is the last question that we have for our panelists, and really it is we're asking for advice. We will like to hear, and we're going to start with Adrian and then move over to Andreas. Here's my question for all of the panelists. What one piece of advice do you have for other manufacturers to support access for diabetes management for people living with diabetes in LMICs? One piece of advice. Adrian, please.
If I have to limit myself, thank you, Karen. If I have to limit myself to only one piece of advice, I will make the loop back to the beginning of this fireside chat. And I will say partnerships are the key to success. So finding partners with common interests, finding partners ideally with local knowledge, with connections, understanding the intricacies and the differences of the local healthcare systems is really absolutely key. And this is where you can be creative because partnerships outside of just finding a good commercial partner, that can include NGOs, it can include clinician organization, patient advocacy group, etc. So really, again, back to the beginning of the talk, partnerships are the key to success from my point of view.
Yes, and I would say I strongly agree with that. And I would maybe add that yes, while we need to be structured and we need to be organized, at the end, any action happens locally. So start bottom up, be tangible, be real, act with people that know the environment, that know the ecosystem on the ground. I think that in my perspective is the most important piece of advice that I can add to the general importance of partnerships that we have explored over the past couple of minutes. One player alone cannot address the burden that diabetes poses on us. And so we really need to rally the troops with industry, with governments, researchers and scientists, practitioners, patient advocates to unite the efforts and advance the provision of care and the availability to care. And so we at Roche Diabetes Care, we work together on this so that in the end, patients, people with diabetes have access irrespective of where they live.
I want to bring it back to the strategy, because I think my piece of advice to the manufacturers would be investing in creating innovative, sustainable global access strategies around pricing, product portfolio, and product support that can really dramatically increase the number of people accessing glucose monitoring technologies. Because the way we've seen with, over the recent years, the increase was incremental. What is the solution, that can work for all to really make a larger leap?
I think that for this last question, I will speak in French. It's a call of action. Voilà, donc je pense qu'on l'a déjà dit, comme quoi la prévention du diabète occupe une place vraiment très prépondérante dans les stratégies de lutte contre les maladies non transmissibles. Et pour ce faire, il est très important d'assurer la disponibilité en continu des dispositifs de surveillance et de suivi du diabète. Donc, on veut vraiment profiter de cette occasion pour faire vraiment la promotion du renforcement du partenariat public-privé, pour favoriser ainsi la collaboration entre le ministère de la Santé, les entreprises et les ONG, afin vraiment de rendre accessible le coût des dispositifs de surveillance et de suivi des diabétiques, de mettre en œuvre des programmes de formation pour les professionnels de santé, de mettre en place des programmes d'éducation pour les patients diabétiques, et aussi de travailler sur des projets qui vont renforcer le dépistage et la prise en charge des patients diabétiques, d'accompagner aussi le ministère de la Santé dans la formation des ressources humaines qualifiées, de qualité, mais aussi dans l'équipement des structures sanitaires, de renforcer le plaidoyer à la participation de tous les acteurs, notamment la société civile, mais aussi les collectivités territoriales dans la lutte contre le diabète, de faire la promotion des bonnes pratiques et des expériences réunies. En dernier, vraiment booster la gestion et l'analyse des données de la lutte contre le diabète, parce qu'on sait que sans données, on ne peut pas vraiment avancer. Donc vraiment, c'était ça l'appel à l'action qu'on avait pour partager avec tous les membres de ce panel, mais aussi pour tous ceux qui vont nous suivre. Merci.
I want to close by thanking all of the panelists today for their time, their effort, their commitment, first to come and talk with us today, but also the passion and effort that they put into these collaborations, these partnerships. It's only through this work that we do together and collectively that we can make progress along access for the diabetes continuum of care. I want to thank also the viewers and the listeners for spending time with us today, and we wish you all a very good day. Thank you.